All right. Good morning, everyone. I'm Everell Eaton, the Membership Director at the Greater Wilkes-Barre Chamber. Thank you for joining us for this week's Wednesday Wisdom. Before I go into details for today's event, I wanted to cover some housekeeping items. You'll be muted to begin the event today. If you wish to share or ask a question, please raise your hand or enter that question in the chat. Please add your contact information in the chat if you wish to be contacted by attendees from this event. The chat is downloadable for your reference later. Please click on the three dots near the chat box to download. If you have any technical difficulties during the event, please reach out to Michaela from our team for assistance, and you can get her at events@wilkes-barre.org. The event is being live streamed on Facebook, and a recording will be available by the end of the week. Today's Wednesday Wisdom will be a panel discussion featuring human resources and employment and labor law professionals from OneSource H.R. Solutions and Horgan Kluger Quinn Law to provide answers to frequently asked questions pertaining to the COVID-19 impact on your business as we move into the yellow phase. We'll cover reasons why employees may refuse to return to work, what to do if employees refuse to work, the Families First Coronavirus Response Act and eligibility, HR policy considerations for employees returning to work, and recommended policy must-haves. To be respectful of everyone's time, we have allotted time at the end for questions and answers. So let's get started. Today we have with us Susan Hosage, from Senior Consultant with OneSource HR Solutions, Jennifer LaRue, Benefits and Lead Specialist with OneSource HR Solutions, Lars Anderson, shareholder at Horgan Kluger Quinn Law, and Bill Amon, Vice President at OneSource HR Solutions. We'll begin with Susan covering reasons why employees may return to work. And Susan to kick us off.
Who didn't want to return to work after being laid off or furloughed. There were many reasons that were provided, and we're going to cover the top three. First, employees didn't want to return to work because they were able to earn more money between Pennsylvania unemployment compensation and the additional $600 per week provided by the CARES Act. It's important to note eligibility for both of those benefits is predicated on being available for suitable work. Therefore, it was explained to employees that refusal could result in the loss of this income. Additionally, as employers, the state of Pennsylvania asked that employers complete the UC 1921 Employer Questionnaire refusal of suitable work be completed and submitted. Employees as well are also required to answer the question about whether or not they were available or offered work during the initial and biweekly claim submissions. The second reason we received was related to employees who reported that they had a physical or mental issue that made them unable to return to work. In this case, the employer was required to engage in more questioning regarding the specifics. The first was to determine if the employee had a disability or a record of a disability. Remember, these were former employees, so there may be something on file. Since these individuals, again, were employed by the company, there may be some additional information for consideration. If the employee was reporting a new issue, however, it was necessary to determine the nature of the disability, job-related limitations, and how they might be addressed through accommodation. This could involve modifications to the work environment, unpaid leave, or possible remote working. If the employee was not able to perform the essential duties with an accommodation or was looking for leave for an indefinite period, it was possible they were not meeting the definition of a qualified individual with a disability. If this is the case with one of your employees, it's highly recommended that legal counsel be consulted on a case-by-case basis. The last but very common reason was fear of the COVID-19 virus. In this case, it was important to get at the specifics of what the employee's fears actually were. In many cases, reviewing the return to work policies and the additional steps the company was taking to ensure employee safety were sufficient to alleviate those fears. It was also important to determine whether the fear might be covered under OSHA. Did a danger exist that could be reasonably expected to cause death or physical harm immediately? We didn't find this to be the case with any of the clients we assisted, since most work environments were considered to be low risk. And in the case where risks did exist, they were mitigated through use of PPE, through thorough and frequent cleaning and other preventative protocols. For these individuals who remained in fear after these discussions, many of our clients allowed employees to utilize available PTO or others extended unpaid leaves in hopes that additional time off would increase their comfort levels in returning to work. In our experience, nearly all reluctant employees returned to their jobs. However, in some limited circumstances, a few employees opted to relinquish their position through voluntary resignations. Well, that's always an option. Again, there are repercussions that many employees may not understand. Again, for employees to collect Pennsylvania unemployment benefits upon voluntarily resigning, they must show a necessitous and compelling reason for leaving available work. Again, this is another area where employers need to be responsive in providing detailed information about the leave options, return to work policies, and risk levels of these specific situations in their unemployment compensation responses. Ultimately, the Bureau of Unemployment Compensation determines whether the employee is able to collect. But again, as employers, it's our responsibility to respond in a timely manner so that the determination can be made with all the available information. At this time, I'd like to introduce my colleague, Jennifer Lamoureux.
Thanks, Susan. We're going to move on to the Families First Coronavirus Response Act. Some of you may be asking, what is this act? Well, it was signed into law on March 18th and provides funding for free coronavirus testing. It provides a 14-day paid leave for American workers affected by the pandemic. It expanded reasons for Fmla and also provided an increase in funding for food stamps. What benefits does the FFCRA extend to employees? Again, it's a 14-day employer-paid sick leave. For the employee, that employee can be paid at 100% of his regular rate of pay as long as he is out on leave for his own illness. If that person or employee is out to take care of another person that is ill, it would be paid at 2/3 their normal rate of pay. The FFCRA also expanded the reasons for family medical leave and provided 10 weeks of paid leave under that law. So if an employee is out for the care of a child who no longer has school, they can get paid at 2/3 their regular rate of pay for up to 10 weeks. How does an employer determine FFCRA eligibility? There are actually 6 questions that the employer can pose to the employee, and based on their response, the employee would either be paid at 100% under the employee paid sick leave or 2/3 under the remainder of the law or FMLA. The first question is the employee subject to federal, state, local quarantine or isolation under COVID-19? The second question is, has the employee been advised by a healthcare provider to self-quarantine? The third is the employee experiencing symptoms of COVID-19 and seeking a medical diagnosis? The fourth question is the employee caring for an individual who is subject to either number 1 or number 2? So questions number 1 or question number 2. The fifth reason is the employee is caring for a child whose primary or secondary school or place of care has been closed, or their child care provider is unavailable due to COVID-19. So we're talking your mother that watched your child, your grandmother, anybody that you use for child care would fall under number 5. The sixth reason is the employee is experiencing another substantially similar situation or condition specified by the Secretary of Health and Human Services. So we also offer a form with this information on there. If anybody is interested, we can certainly provide that if you're looking to use it for your own company. At this time, I'd like to introduce Lars from Hergen, Kluger, and Quinn.
Hello, everybody. So to tag along with what Jen just said, the FFCRA is applicable throughout the rest of this year. And so the emergency sick leave, that's going to be continuing to apply from now until December 31. Same for the expanded FMLA, except the expanded FMLA, remember, is only tied to when the school or place of care is closed. And so in that scenario, we're about to have schools ending for the summer. The closure has to be COVID related. So school closure for the summer doesn't qualify as COVID related. Does that mean then if a child is home for the summer and their summer camp is closed that they can't qualify? Well, no. So FFCRA would still be applicable if the normal care for your child is closed during the summer for COVID related reasons. There is one exception here to that, which is that if alternate care can be found. So if you're typically using a family member, if you could use another family member, then the FFCRA expanded FMLA wouldn't apply. If you're typically using, say, one summer camp program that's not opening, but other summer camp programs in our area are opening, then FFCRA may not apply. You really have to have an individual look in each case to make an assessment as to what's going to happen and what the applicability is. So moving on then to the next topic, and I'll wait for Ahmad to catch up with the slides, or whoever. But so Susan already talked a lot about what happens when an employee doesn't want to return to work, and the UC aspect of it. But to get a little more into it with regard to ADA, FMLA, and FFCRA, right? So if you're calling employees back because you're moving to yellow, or if you're waiting till we're moving to green, and you call an employee back and they say they're not ready or they don't want to come back, you have to have a further conversation. And that conversation's got to start with what's the reason. If they say, as Susan said, it's because of their pre-existing condition or because of something else, you got to dig deeper. So, the first starting point is, does the ADA apply to the reason why they're asking not to come back? So do they have a disability? If that doesn't fit, then look towards medical conditions that could possibly be covered by the FFCRA, which Jen covered already. So those first 5 items, or first 4 question points, right? If none of those apply, then is it something else, right? So not a disability, but another medical condition, and could FMLA apply? As you go through each of these, you're going to be getting more information from the employee, and you're going to be becoming more specific for the facts. But each time you have to go through the process, or else you can make a mistake. A lot of questions I get from my clients is, isn't there just a one-size-fits-all solution? Can't we just do this one form, or can't we just do this one process? Unfortunately not. All of these laws are going to interact, and you want to make sure you're being compliant with each one, okay? So with that, I'm going to turn it over to Phil, and I think you're going to hear about some policies now.
Good morning. Thank you, Lars, and good morning, everyone. Assume you can hear me okay? Thumbs up. All right. So with the time that I have, I really have 2 goals I want to set out. You've heard a lot about the laws and what needs to be done as it relates to the workplace. Without a written policy that is well structured and one that you can implement fairly, it's going to be problematic for you. So my goal really is 2 things when we're dealing with COVID-19. Understand the importance of having a written policy, and one that you can implement in a fair and consistent manner. 2, I want to make sure we highlight some of what I call the must-haves we have in a policy as it relates to COVID-19. There's so much going on out there, and so many things are changing throughout CDC directions and everything else. It's going to be an ongoing process to keep these policies together and keep them current. So if you haven't figured out, I mean, the game has changed, and without clear written guidelines, it's never been so important. It's important to the business, it's important to you and your position there, and it's important to the employees. So let's get going a little bit. You've heard probably terms flattening the curve, opening up America again. So one of the main reasons to have a policy that addresses the COVID-19 is what the White House has recently unveiled, and I'm quoting this, they're charging all employers to develop and implement appropriate policies which keeps workers safe from the COVID-19 or similar diseases. So in doing this, it's really important you carefully evaluate what your legal obligations are, along with ongoing guidance that we're getting from the government with a policy that you might create. A second reason to develop a good policy is there's this little government, we haven't talked about it yet, a little part of the government called OSHA. And there was when they were the act was first passed for OSHA, they passed what was called the General Duty Clause. And it states, and I'll read this, a place of employment which is free from recognized hazards that are causing or likely to cause death or serious physical harm to its employees. So with that being somewhat their charter, they have stepped in and they have introduced some standards that all employers need to be aware of, because this is brand new and it's challenging the workplace like never before. So that is the second reason that we are recommending that you guys take the time necessary when you're bringing employees back, that you have a good written policy on how you're going to handle that in case OSHA comes over for a visit, which nobody really wants. Let's see. So the third thing is, as Laura had talked about, EEOC and ADA. And if there's anything that I personally am concerned for our clients or anybody that we work with, is how they're going to put these policies in place and fairly, in a non-discriminatory type of way, implement them. ADA, if the American Disability Act is set up and the EEOC enforces those laws, and really, historically speaking, they've never really allowed us to medically test employees. And now we're seeing screenings of all sorts, taking temperatures. So it's changed the game a little bit. So today, the things have changed. And even though the ADA laws still apply, they can't stand in the way of what the government's asking us to do, especially with recommendations that most of us are following or hearing about, like with the CDC. So it's really going to be a balancing act, and so important that this is done in a way that you can implement in a non-discriminatory type of way. So reasons for the policy, those are the three big ones. There's many, many more, but those are the ones that we're trying to guide our clients through. So policy must-haves. There's lots of them, but we now know why we have to have a policy. Now we got to think about things that are specific to the workplace. I'll just give an example. I took my kids to the orthodontist last week, and the protocol that we had to go through to get my kid up into the orthodontist chair was pretty strict. So we had to call them from the parking lot. They had to text us when they were ready for us to come up. We had to make sure we cleaned our hands. The kids obviously had to brush their teeth and gargle. Then they had to answer all of these questions about where they've been, if they've been exposed, do they have a fever. So, and maybe some of you guys have seen this, because we're seeing this in real estate. We're seeing this at camps and schools and anybody that's opening back up. Very similarly, if you don't have a policy like that on how are you going to bring these employees back or hire new ones, we're recommending that you do. And here are some of the basics that we would want to talk about. One, I think I can't see the slide, but the slide is up there, the attestation form. We think it's very important that any employee coming back completes a form that you provide so it's consistent and asks certain questions similar to what I just explained. Take a temperature reading of the employees. There's a lot of arguments out there about, well, just because you have a fever doesn't mean you have COVID. Also, you might have COVID and no temperature is present. We understand that, but that's one of the things that we should be doing as a step to try and monitor and make sure employees are properly screened. So have a form filled out that the employee asks certain questions, where they've been, if they've been exposed to anybody. So that's that first part of that, right? Okay. Control measures. There's three, maybe you've got four, but we'll talk about three of them right now. The personal protective equipment, PPEs, and I think most of us have probably heard of those. that's something else that the CDC has come out with, and you've probably, anytime you've gone to a grocery store, you've seen people wearing masks, you've seen these plastic shields, you see gloves. These types of things, you need to determine what's right for your workplace. Not only for your workplace, but some employees might have certain contact with public that other employees won't. So what are you going to do for those employees that are perhaps socially exposed to customers or to fellow workers, as opposed to the other ones that don't have a lot of interaction? You need to think about how you're going to provide them these, you got to decide what it's going to be and how you're going to provide it to them. So we recommend making sure you've got PPE available to your employees. For instance, here we have masks for everybody that we feel needs to be wearing them, and make sure that our employees have them. Second piece, temperature screenings. Talked about that a little bit. I live in Mountaintop. I go to Wise grocery store. I have not yet gone into that store yet where there isn't an employee out front taking the temperature of every employee showing up for work. That's their policy. Whether you do that or not is up to you. I think you need to determine if that's right for your organization. We think it's a good way to ensure that you are doing everything you can to protect the employees that work there. So some of our clients are doing it at the beginning of every shift, and it's got to be across the board. They're taking the temperature of everybody that comes into work at the beginning of every shift. Something you should think about. We can talk about, if we have enough time, what you do if somebody does have a certain level of temperature. CDC guidance, I think it's 100.4 or higher, you're sending the employee home until they are able to come back. Some sort of doctor's evaluation, a test negative for COVID-19 before they can come back to work. Remote working if possible. You need to try and accommodate these employees while they're at home or doing what they need to do to make sure that they're free of COVID. Next one is social distancing. I think we all probably could measure out 6 feet without being blindfolded now, but it's the same type of principle. You got to have you've got to have those types of things in the workplace. So if yours has close working quarters with desks, it's an open cubicle type of situation, you got to be thinking about how you're going to spread those desks out and keep that social distancing in the workplace. Face-to-face meetings, I mean, 3 months ago, I didn't know what Zoom was. Now it's on the tip of everybody's tongue, everybody's using it. So do you have that or something similar to be able to minimize people getting together in the workplace? Again, these are things that should be in your policy, because if they're not being followed, that's when you need to be able to address it to the workplace. Limiting travel, I think, is on your slide there. I think that kind of goes without saying. We're seeing lots of customers who are now not traveling to customer sites. I actually have a meeting with a client I usually visit once a quarter on site. We're doing that through a Zoom meeting. Minimize that travel unless it's absolutely necessary. So the next part of the slide, how to handle infected and exposed employees. We could talk for hours on this one, and Lars kind of talked about it as well, because one of the things we got to make sure we do is not be discriminatory, and we don't want to be inconsistent about how we go and do it. So if someone comes to you and says that they're exposed, there's certain protocol you got to follow. If they are saying that they are actually infected with it, a different set of protocol. First and foremost, it's almost like an accident on site. You've got to have a policy that talks about you've got to report it immediately. You can't waste time on it. And when they do report, who are they going to report it to? You'll see we talk about maybe considering appointing a COVID-19 coordinator. Maybe it's the risk manager, maybe it's your HR person. Find someone who knows the policy and can implement it in a fair, consistent manner. If they come to you and they're exposed, we get a lot of these questions. Should I send the person home? They're not sure. Someone that's exposed, it's a little bit different game. You've got to figure out, if you follow the CDC guidelines, how long were you exposed, for what length of time. They want you to walk through some of this. I will just tell you, it's better to be cautious, and we recommend you send that person home, have them self-quarantine, have them get evaluated by a medical professional, and not be able to come back until they can show that they are negative on COVID-19. If someone is telling you they have it, clearly got to go and take care of themselves until they can come back with clear symptoms and clear testing. Again, remote working if it's possible, something that you want to do for them if possible. I feel like I've gone really quickly, and I apologize. I just want to make sure I cover some of the important things. Let me just go to the final thoughts then on developing a policy. And this is how I feel. You know, policies aren't required by law, but they're all so important. And I think really, really important for this pandemic that we're facing as employers. If you think this is something you can just get done and just set on a shelf, don't even waste your time doing it. The reality is that if it's in your policy and it's written, you got to practice it. If you don't practice it, your practice is your policy. So this is changing so fast. We're seeing new interpretations coming out almost daily. You need to keep up with this policy to make sure you're current as things change. So be careful about it. I would certainly seek professional and or legal advice on what you are drafting. And there's a lot there that we haven't even covered. We haven't talked about benefits and retirement plans and PTO to a certain degree. So all these things come into play on how you're going to enforce this in the workplace. So I don't want to jump the gun, but we have developed, and it's free to everybody that's on this meeting, a template, if you will, to get you started. It covers, we feel, the basics, a lot of the stuff that we've talked about together as a panel, and that will be made available to you guys if you want. It's free to use, and it's easy to adjust for your specific workplace. I think that's it. I think that's all the time that I've got.
Awesome.
I think we're opening to questions.
And yeah, Phil, we'll send that out too to all the attendees. I covered that. But before I get to the questions, I know Blake had something that he wanted to circle back.
Yeah, I just wanted to add to
I'm going to give it back to you.
Sorry, Ben. I just wanted to add to Phil's point about temperature screening, right? Yeah, I've had many clients say, I don't want to do it. It's not necessary. One thing to remember is it makes other people feel better if you're doing it in the workplace, helps put your other employees at ease. And during the yellow phase, if you have a confirmed case, you have to do it. So starting the process early before you even get into a confirmed case is not a bad thing. And I think, you know, as Phil said, it's very good to start these processes in the beginning and keep them consistent throughout. Consistency throughout how you handle the situation will help you defend against any discrimination or EEOC claim that may come.
Completely agree, if you can hear me.
Continue to talk.
All right. Thank you to all our panelists. This is awesome information and stuff that we definitely need to hear during this time. And then just before we wrap up, a couple of questions that we kind of received in advance. Want to go through with each person. Jennifer, I'll start with you if that's okay. Does FMLA provide any more FMLA time off?
So the answer to that is no. The emergency or expanded FMLA does not provide more FMLA time for the employee to use. The employee is allotted a certain number of hours based on their time worked. So if you work a 40-hour work week, you would get 480 hours to use. You do not get more than that allotment of time in the calendar year. So there is no extra time available.
Thank you, Jennifer. Susan, I'll pick on you next. I think there are many companies out there who are considering or temporarily adjusting hourly pay rates or offering bonuses to encourage employees to return to work. Is there any downside to doing that?
Yes, many companies and many of our clients opted to put some compensation-related incentives in place to encourage employees to come to work. Many folks did hourly pay adjustments with their non-exempt employees, and again, increased compensation is always a great motivator. Unfortunately, there's a time when that increase is going to end. So our suggestion is, for anybody who's thinking about it, it's a good idea at the time that program is launched to define the end date so there are no surprises in the future when that additional amount is reduced. For those clients who opted for bonus payments, that's also a great motivator, and it gives employees a chunk of cash at one time, but we have to be mindful of the fact that when we apply non-discretionary bonuses for non-exempt employees, they are subject to the premium overtime requirements under the Fair Labor Standards Act. So it's important to recognize that that bonus that you think is, $500 might be more than $500 when you consider the overtime calculation.
Awesome. Thank you for that. Lars, I'll go to you next. Why in the yellow phase of reopening, do employers still have to require employees to telework?
Yes, Governor Wolf's directive and business plans indicate that if employees can continue to telework, they must. When we move into green, we don't have the guidance out on that, but it's going to be probably recommended that if you can't allow employees to telework, you should. But while in yellow, if they can, you must allow them to. Now, that's not going to translate into every sector or every employer. You have to do an analysis.
I've got a couple for you, so I'm going to keep on you. With the new workplace safety measures that employees have to follow in the yellow and green phase, what should an employer do if an employee refuses to comply or violates these safety measures?
So that's going to go back to kind of what Phil was talking about with the policies, right? So you're allowed to operate right now in yellow and green, but you have to comply with the government's orders. And so by employees not following these policies, it opens you up to exposure either to fines or penalties from government and or OSHA, as well as other problems. And so you're going to have to enforce the policies on the employees in a non-discriminatory way. But as long as these policies are neutral throughout and applied evenly to all employees, they should not be discriminatory. And so if somebody doesn't want to follow, they're going to be disciplined, and you're going to have to enforce it upon them. Now, minor infractions, maybe, somebody took their mask down to talk on the phone. You could start with a verbal discussion with them, or maybe a Zoom discussion, in this environment. But start small, but work up, and make sure everyone knows that they have to follow these or else.
Two more for you. If employees did not return to work due to the COVID-19 pandemic, what does an employer need to do besides notifying the unemployment office?
Ben, I think I covered that one in my presentation, but that's going to be what we talked about of running through that analysis of ADA, FMLA, FFCRA, and seeing if any of those are applicable. Right. So, starting with notifying, the unemployment office, and that may cut off someone's unemployment benefits, or it may not. They may still be eligible. But going through and doing that individual assessment on each employee to determine if there's other laws there to make sure that you're not violating another law by not having them return to work.
Awesome. Thanks, Lars. I'm going to jump to Phil. Phil, how do I keep employees safe? Employees who interact with customers.
I did not hear all that, Ben. Could you repeat that question?
Sure. How do I keep employees who interact with customers safe?
Employees that might interact with customers.
Yes, yes.
Yeah, so, each situation is unique and it depends on how much, but I think it's the obvious things. Clearly, you want to keep your social distancing guidelines in place, 6 feet away. If they can meet remotely versus in person, that is great. I know if it's a small business that's retail or it's a carry-out restaurant, hopefully the restaurant itself is making sure that they're doing the things that are necessary with touchless delivery. But it's just that social distancing, making sure they're wearing a mask. And also, I think it's important that they need to report to you if they are symptomatic after interacting with the customer, so that we can, as an employer, start, there's whole methods of, we have talked about tracking that down and finding out the source of where that might have come from. So it's a lot of the guidance that the CDC has given us. And another thing too, and we implemented this here a long time ago, and I see people missing this quite a bit, is disinfecting and having different cleaning protocol for everything from copiers to doorknobs to bathroom facilities. People tend to forget that all that stuff could be potentially a place that they could get contaminated. So if they're dealing with customers as well and being at the customer site, same type of protocol we'd recommend. So it's just awareness.
And with employees who have a higher risk of severe illness, is there any extra protections or anything that an employer can do to help protect that employee?
Yeah, because we have a lot of clients that might have some older people, older workforce, and we know that this seems to prey on those that might have respiratory illnesses. So, the first thing is just getting to know the employee and talk to them about it. If they've got concerns, listen to them. You want to be careful about asking too many medical questions, but just ask them what's going on and why they're concerned, and then put in measures that will minimize the risk of them being exposed. And it might be, I'm not saying go to 12 feet away, but making sure that those types of things are implemented and they're following those policies as well. But I think there's only so much that you can do. I think the most important thing is just listen to them and their concerns, because they just want to know that you've got processes in place that's going to help them. And take extra caution, not put them in harm's way.
Awesome. And then last question I got. If an employee tells me that they've been exposed but are not showing any symptoms, should I still allow them to work?
Yeah, and I try to cover some of that, and I may have glossed over some of those things. If they are exposed but not showing symptoms, I don't want to say it's a judgment call. I would err on the side of caution. I think they need to self-monitor. They need to go get checked out. Personally, and again, it depends on what the policy says, I would encourage that you send that employee home. It's not worth the risk of them maybe being exposed but not showing signs yet to infect the rest of the workplace. So I think a good practice is to send them home. And again, there's different things that you can do, how long they were exposed, where, why they're feeling this way. It's another conversation. I think the default is you send them home. Not everybody's going to want to hear that, I get it. But.
Awesome. Thanks for your time, and definitely great information out there. We did record this discussion. We will share on Facebook, so you can share this information. We encourage you to connect with each other using the contact information from the chat. Also, Chamber will keep sharing information and resources as we work together through this time as a united community. In addition to our resource page and communications, we have different interactive tools on our site that you can submit any issues or questions about the COVID-19 pandemic, and we'll connect you with the resource and assistance that you need. Thank you again, and join us next week via our Zoom for our next Wednesday Wisdom. We're going to cover on that one the Luzerne County Ready Pledge that just launched, and how to safely reopen your business. If you haven't done so already, sign up for our newsletter to stay up to date with all our upcoming events. We hope you all continue to be well and stay safe and enjoy the nice weather out there. Thanks, everyone.